Welcome to my channel MK MediGuide Lectures, learning with artworks like drawing and calligraphy.
In this fourth video on metabolism of drugs, we will discuss about the isozymes of Cytochrome P450 enzyme system. CYP450 enzymes are divided into subgroups depending upon the sequence of amino acids in each isozyme. These enzymes have the capacity to modify a large number of structurally diverse substrates. In human beings, isozymes that fall into families CYP1, CYP2, and CYP3 are primarily involved in the metabolism of most drugs, in which the most active CYPs for drug metabolisms are those in the CYP2C, CYP2D, and CYP3A subfamilies. In addition, an individual drug may be a substrate for more than one isozyme, such as tolbutamide, paracetamol, barbiturates, and nifedipine are substrates for more than one isoform. Important isozymes include CYP3A4, which is thought to be the most predominant CYP isoform involved in human drug metabolism, both in terms of the amount of enzyme in the liver and the variety of drugs that are substrates for this enzyme isoform. In addition to liver, this isoform are expressed in intestine, responsible for first pass effect at this site, and kidneys as well. This isoform may account for more than 50% of all CYP-mediated drug oxidation reactions. And CYP3A4 is likely to be involved in the greatest number of drug-drug interactions. However, the fact that two drugs are metabolized predominantly by CYP3A4 does not mean that co-administration will result in a drug-drug interaction, since drugs can bind in different regions of the CYP3A4 active site, and these regions may be different. In fact, it is believed that two drugs can occupy the active site simultaneously, with both available for metabolism by the enzyme. This finding helps account for several absent interactions that would have been predicted to occur based on substrate specificity rules. CYP3A5, whose amino acid sequence is like that of CYP3A4, appears to have approximately the same substrate specificity characteristics as CYP3A4. However, it differs in that it is not present in all individuals. Thus, individuals expressing both CYP3A4 and CYP3A5 have the potential to show increased metabolism of CYP3A drug substrates as compared to individuals expressing only the CYP3A4 isoform. Drugs metabolized by these isozymes include cyclosporin, simvastatin, HIV protease inhibitors, calcium channel blockers, hydrocortisone, carbamazepine, midazolam, losartan, and nifedipine. The other identified human CYP3A isoform is CYP3A7, which appears to be expressed in fetus and rapidly disappears following birth, to be replaced by CYP3A4 and CYP3A5. CYP2D6 as the next most important CYP isoform, which metabolizes 25% of the CYP-mediated oxidation reactions of drugs including tricyclic antidepressants, selective serotonin reuptake inhibitors, antipsychotic agents, antiarrhythmics, beta blockers, and opioid analgesics. CYP2C8 and 2C9. This isoform handles about 16% of the CYP-mediated drug oxidation reactions. This isoform metabolizes several clinically important drugs with narrow therapeutic margins. Two of these drugs as phenytoin and warfarin, and other drugs like ibuprofen, tolbutamide, rifaglinide, celecoxib, and losartan. CYP2C9 appears to prefer weakly acidic drugs as substrates, which limits the number of drugs metabolized by this isoform, since most drugs are weak bases. CYP2C19 isoform metabolizes more than 12 frequently used drugs including omeprazole, lansoprazole, naproxen, diazepam, and propranolol. CYP1A1 into subfamilies take part in the metabolism of only few drugs like theophylline, caffeine, tacrine, phenacetin, paracetamol, and carbamazepine. CYP2E1 isoform catalyzes metabolism of only few drugs like ethanol, halothane, enflurane, and paracetamol. Large number of drugs are oxidized through these pathways. Few drugs like cimetidine, ranitidine, clozapine are oxidized by a group of Levene monooxygenases that are also located at hepatic endoplasmic reticulum but are distinct from CYP enzymes. Some other drugs like adrenaline, alcohol, marcapato are oxidized by mitochondrial or cytoplasmic enzymes. When two co-administered drugs are both metabolized by a single CYP, they compete for binding to the enzyme's active site. This can result in the inhibition of metabolism of one or both drugs, leading to elevated plasma levels. If there is a narrow therapeutic index for the drugs, the elevated serum levels may elicit unwanted toxicities. For example, a statin and macrolide antibiotic or antifungal. And with this, thanks for watching our video and support us by subscribing our channel, and do like and comment below about our work.